as a healthcare leader, your goal is to inspire people to do great things for the people who work in the system and for the people who are cared for in the system. So really that's your role as a leader. It's just you do it in different places. You can do it very locally, or you can do it in a national stage, and some people do it in an international stage, but it is about influence. It's not about telling people, it's not about power, it is about inspiration, and that's really the key thing you do as a leader.
Welcome back to the Business and Medicine podcast. I'm your host, Adrian Kutschrook, a current M2 at the Schulich School of Medicine. We have a very exciting episode ahead of us. In this episode, we will be hearing from Dr. Gillian Kernaghan, who is the former president and CEO of St. Joseph's Healthcare, a multi-sited academic healthcare organization serving London and the surrounding regions. Dr. Kernaghan received her MD and completed her residency training in family medicine at the Schulich School of Medicine. Dr. Kernaghan was a member of the Premier's Council on Improving Healthcare and Ending Hallway Medicine and past co-chair of the Southwestern Academic Health Network. She has held prior appointments as the co-chair of the Canadian Health Leadership Network and president of the Canadian Society of Physician Executives. Dr. Kernaghan was the recipient of the YMCA Women of Excellence Award in Health, Science and Technology in 2015, the Studer Group Firestarter Hall of Fame Award in 2017, and the Canadian Society of Physician Leaders Excellence in Medical Leadership Award in 2018. Thank you for being on the show today, Dr. Kernaghan.
You're most welcome. Glad to be here.
And we were just talking about kind of what a small world we live in. For those who are listening, my dad's a family physician who's practicing in Sudbury currently, and actually graduated medical school from Western in the very same year, I believe, the same class as Dr. Kernaghan. I didn't realize this until after I reached out. So kind of funny. It's a very small world. Do you keep in touch with any of your classmates from back in the day?
I keep in touch with a few. There are some here in London, and I keep in touch with some who are outside the city. So
very nice.
And it's our one of our class reunions next fall. So we're hoping everybody comes back and we can catch up with people. So.
Oh, excellent. Yeah, it's been a while since my dad went to one of those. So hopefully, especially since now I'm in London, it'll be an excuse for him to see me too. So
tell him he has to come.
Yes, I will. And I noted, so you recently retired from your role as the president and CEO of St. Joe's, correct?
I did.
Are you still practicing medicine?
I am not. I am doing a lot of other system work, but I'm not actually seeing patients.
Right on. And again, congratulations on the retirement. It was 11 years you worked there as the CEO, right?
I was CEO for 11 years, but I had other leadership roles prior to that. And I practiced there when I was in full-time family practice. So.
Right. And so on our podcast, I always find it interesting to hear how physicians' career path unravels after medical school and how physicians find their way into these different leadership roles. So could you take us back to after residency and explain how your career developed and led to the position as the president and CEO of St. Joe's?
Certainly can. It's always interesting because I don't think when you leave medical school that this is where I thought I would have my career go. I joined a group of family docs, full service family docs, who did family practice obstetrics, palliative care, house calls, long-term care, and ran a full-time practice for a number of years here in London. But during that time, volunteered at the hospital. There are a number of hospitals at that time in London, and so volunteered on a number of committees. And through that volunteer commitment, ended up sitting on the medical advisory committee for one of the hospitals, and then had a seat at the board and did their first strategic plan with them. It was a newer hospital, and realized I really quite enjoyed the system work that could make an impact for patients at a different level. So I was invited to apply to be vice president medical for that one hospital in the city, which was Parkwood Hospital, which was a separate hospital at the time. And then through restructuring, the hospital started to come together. And so then I became VP medical for St. Joe's Acute Care Hospital as well. Then the two psychiatric hospitals, which eventually formed St. Joseph's Healthcare London. And then I was asked to be the vice president medical for all of the hospitals in London, including the hospitals associated with London Health Sciences Centre. During that time, I continued to practice part-time family medicine at the St. Joe's Family Medical Centre, teaching residents and medical students, and seeing patients that needed more continuity of care with somebody who was going to be there every week. And so, and then the position of president and CEO became vacant. And I thought long and hard about that, but I really loved the organization and knew that we could make changes in the organization that I wish had been there for my patients when I was seeing patients directly. So I stopped seeing patients about a month after I became CEO. I just couldn't do it all, and took on the role of president and CEO of St. Joseph's Healthcare, and had the privilege of working with an amazing team of leaders and physician leaders to really make a difference in the kind of care we provided in the city, and got to impact the life of patients in a very different way that was very exciting. And that's how I ended up as president and CEO of St. Joe's. So it really wasn't sort of planned for medical school, but it's been a great way to use my strengths and what I'm passionate about in a very different way.
And I love how you
In a very different way.
And I love how you framed it that way because, as a family physician, you're able to impact so many lives as their physician. But when you took that next step and into that leadership role, you're able to make that large scale impact for physicians all across that health network, and really for so many patients around London and surrounding areas. So I think I commend you on that. That's an excellent way to make an impact.
I think when people move into a leadership role, that's an important reframing of the influence. As a family doc, you influence people one person at a time, which is a great privilege to do so. But as a leader, you get to influence groups of patients, and increasingly larger groups of patients, and the ability to really make care better for them. So it's a way that you nearly think about that you are really making a difference.
And you mentioned the restructuring process. Could you take us back and maybe paint a picture of what the healthcare situation or the scene in London looked like? So across kind of all the hospitals and the network, and then kind of what created that decision to want to, I guess, amalgamate a few of the healthcare centers into St. Joe's?
Yeah, back in the mid to late 90s, it was really driven by the government of the day to really try and reduce the number of hospital corporations or organizations. And so they really directed. London Health Sciences had come together, University Hospital and Victoria Hospital had come together prior to that voluntarily. And then the Restructuring Commission went across Ontario and said, we want people to actually merge hospital corporations. So in London, when I was practicing in London, all the hospitals were separate. So if you were a physician in London, you had to put an application in to work at Parkwood, and another one to apply to work at London Health Sciences, and another one to work at St. Joe's. None of the policies were the same. There was no integrated record. There was no integrated phone system. None of the things that are in place today. And so it was an interesting challenge because you had to think about what policy applies to this hospital. For example, the automatic stop orders for narcotics was different in one hospital to another. So you had to try and remember that, because I practiced at 3 of the hospitals and delivered babies at 2 of them. And so it was a challenge. And so when restructuring came in, they directed that Parkwood Hospital, which is a specialized regional rehabilitation hospital, would merge with St. Joe's. St. Joe's would transform into a really innovative ambulatory focused hospital and really try and drive care in a very new way into not in-hospital care, but really more ambulatory and innovative surgeries. And then the 2 big psychiatric hospitals in St. Thomas and London would actually come under the direction and governance of St. Joe's. And so St. Joe's took them over, but in around 2000, and then worked to rebuild those hospitals to be modern mental health hospitals, because they had been built in the 1930s. They were old hospitals, as those who were London remember. And so we built brand new purpose-built hospitals for people living with serious and persistent mental illness. They are regional hospitals. They serve the whole region. And the one in St. Thomas actually serves the province. And so the 4 hospitals that became part of St. Joe's, almost all their programs are actually regional programs that serve most of this region in southwestern Ontario because of the specialized nature of the care that we provide. And we stopped at St. Joe's all the more local services like obstetrics and the emergency services moved to London Health Sciences. who provides all those services in addition to some very specialized regional programs in addition to the work that they do. So just a real shuffle of the services in the city.
Hmm. And it sounds like it makes it a more efficient process and really have each hospital tailored to their specific area, which makes it easier to coordinate patient care, it sounds like.
It does. It allowed a focus on some areas that don't always get a lot of focus in the healthcare system. So I think that was a real advantage of the move. But it's very important that all the hospitals continue to work together because we both provide care to people in London and the region. And the two hospital corporations also are the teaching centres that teach medical students and nurses. And St. Joe's trains about 2,000 to 3,000 students every year. And that's a lot of people. So that's part of our mission. And then we work together to create the healthcare of tomorrow through research, through an integrated research institute. So really, it's a very collaborative model between the two hospital corporations and the university, both the Schulich School of Medicine, Dentistry, and the Faculty of Health Sciences, and other faculties that provide health training.
And I wanted to go back to that initial decision when you accepted the role as CEO and president there, and you had to make the decision between caring for patients and then obviously taking on this large role and not being able to carry on your clinical practice. Could you take us back to that initial decision and maybe how you decided to go about this? What factors did you take into consideration?
I think the biggest factor in making that decision was the opportunity to really take an organization that was a really good organization to being an exceptional organization in the care they provide and as a place to work. And it had so much potential and so much opportunity, and the people who work there really had a heart for the people that we serve. And I knew that as a leader, there would be the opportunity to really make a difference and really work to improve both the quality, the access, how we do care, but also what it is like as a place to work. Because if we're not really focusing on the people who are serving in the healthcare system, we will be in trouble with the quality of care that we provide. So those two opportunities were really instrumental. I loved the organization. I had worked in it for a number of years and knew the team and the people and the heart of the people that worked there, and knew that we could really make a difference for the people of London and the region. So that was really my motivation. And I think it proved to be a wonderful choice because we did get to do some amazing things. So, and the nice part was that some of my patients from my full-time practice and some of my patients from my part-time practice drop me notes and have kept in touch and talk about the care that they've received within St. Joe's and how much they value the care that they've received. So that's also very rewarding to know that you're continuing to help them, but indirectly. So.
Well, very inspiring to be able to take that step and really make that huge difference. I think a lot of medical students will really look up to that, and I think it is interesting when because to take on a position like that, you will have to make that sacrifice and kind of do that thing that you went to medical school for, to really take care of patients and be there with patients on a day-to-day basis. But really, there are these opportunities outside of clinical medicine that can make such a huge difference on healthcare and will really, change the face of healthcare in London and around the province in Canada. So really amazing to hear. And I was wondering if we could take a look at a typical week, what a typical week would look like for you when you served in that role.
A typical week, the last 2 years have not been typical weeks because of COVID, as you can only imagine. But a typical week started early, usually started, I was at the office before 7:30 and was really very much involved in meeting with people. The first 2 or 3 years very focused on the organization and bringing an organization together, common culture, common goals, really setting our sights on how we were going to have excellence in the work environment. So really working with a lot of people in the organization, but also locally within in the region. But as you became more more established in your role, taking on a lot more provincial responsibilities. And so really it involves a lot of meeting with people. People will meet one-on-one, groups of people, and it involves working with teams in your organization to set goals, to do leadership development, to orient new staff. And they were long days. They were usually 12-hour days. That would be a fairly typical day. And once or twice a week, it would be a 14-hour day. And so they were long days. I was in Toronto, usually at least once a week, sometimes twice a week, for meetings with the ministry, with the Ontario Hospital Association, and then of course served nationally on some initiatives to really try and inspire healthcare leadership across the country, both in physicians and in other professionals. And that required some travel. I continue to teach, actually. I teach leadership courses to physicians across the country. So I would sometimes work all week till Friday, and I'd fly to Vancouver Friday night, and I'd teach all day Saturday, Sunday, and get the red eye home Sunday night and go to work on Monday. And so a very varied week, and lots of working with people. So one of the skills you really need in a leadership role is actually how to work together with others and how to inspire others towards goals and goals that they might not have thought they could achieve, but inspiring them to go beyond what they thought they might be able to achieve and supporting them to get there. And so a lot of working with individuals and advocacy. Obviously, it was all about quality. It was about the work environment. It was about budgeting, because as you can imagine, the first few years we had to actually do a lot of budget cuts in the organization. And so lots of working together to keep our focus on who we were serving. Really, that was what the week looked like. But you can't do it without a great team around you. So.
For sure. So the decision to pursue family medicine, did it help you pursue these leadership roles, and maybe gave you a perspective from the patient's point of view in how you can help improve the healthcare system?
When I was in family medicine, I made a decision to volunteer in hospital committees, but I made the decision to volunteer in committees that required me to give up income during the day rather than evenings or weekends, because I had 2 young children at home. And so that was a decision I made, because I was on, as most docs were back then, on a fee-for-service model. And so I actually chose to make less money in order to participate in some of these activities, and so that it didn't interfere with my time after work with my kids. So yes, that was the decision that I made, and I think any physician group can make that decision, but that's a very personal decision that you wanted to be involved differently in the healthcare system. And I think the nice thing about being in family medicine is you know a little about a lot, but not a lot about any one thing, right? If you think about, specialists can be very narrow and deep, family medicine is very broad. And so you have a sense of kind of the whole system, and you have a sense of what all the specialties do because you have referred to all of them. I think the other advantage is I was a community family doc. I wasn't in a teaching center. I ran my own practice. I ran my own small business, right? When I was in practice, I had to learn to hire and fire people. I had to learn to negotiate rental agreements. I had to actually figure out how to actually run a small business, which actually was really good. I had to learn those because I didn't learn those in medical school. So it was by trial and error that I learned those. And so I had that community focus when I became a hospital leader, which I think was very helpful, because if you've only ever worked in a hospital, you don't have a sense of what it's like to work in the community. And so having been able to straddle both and actually looked after my patients in hospital, but ran a practice, I also worked as a long-term care physician, so I knew the struggles in long-term care, which was also helpful. I did house calls, so I saw the struggles people had trying to access care who actually couldn't leave their home. And so with that background of experience, I think you do have a very broad sense of the system, and what community challenges are, what long-term care challenges are, and also what hospital challenges are. And so I think that was a real strength coming into leadership in the system, as with having that kind of breadth. Now, there are amazing physician leaders that come from all disciplines. Some are a little more flexible than others, and in the ability to flex how you can book into meetings or scheduling meetings. I mean, if your OR day is every Tuesday, you really can't go to meetings on Tuesdays. So that limits you a little bit. But I look at emerged physicians who work shifts. They can often manage their shifts so they can participate in leadership and contributions as well. And so there are great leaders from every discipline. I found my background was helpful because of the breadth that I brought to the table. And it was particularly helpful when I was running the regional response to COVID over the last 2 years. So I understood primary care, I understood long-term care, and I obviously was a hospital leader, leading the hospital response. So that was very helpful in the background because of the breadth of knowledge, but also where I had chosen to practice. That also helped as well. So
For sure, yeah, it sounds like that broad scope of knowledge and really the knowledge of the healthcare systems really helped you in that role.
mhm.
So you mentioned, I guess in medical school, you weren't really sure about, you didn't really think that you were going to take on these leadership opportunities, as I feel a lot of physicians um, end up in these roles without really planning that in their career. So I'm wondering if you could let us know if you pursued any leadership opportunities while in medical school, and maybe while in medical school, did you have an interest in leadership, and how did this kind of all come about?
Yeah, I had an interest in leadership actually before medical school. I had been a leader in my high school and had run the women's athletic program for a very large Toronto high school, and had been sent to a leadership development camp actually by my high school teachers. So they saw something in me that I may not have seen in myself at that point in time. Didn't take on a leadership role during medical school, but realized that when I started doing work in the hospital system early in my career, there's a body of work that's called strength-based leadership, and it allows you to identify what your leadership strengths are. And the literature shows that if you actually take on work that allows you to use your strengths, and 60% of the time you're using your strength, work will not feel like work. And I started to realize that when I was doing the system work and leadership, that I was very energized. I could work a 12-hour day and still go home and be energized and excited about what I was doing. And that's a clue that that is a strength that you have. So I started to realize that it was actually a strength in which I could build. And so when I did have the opportunity to take on a sort of first formal senior leadership role, really started going to leadership courses, leadership training courses, investing in leadership. But leadership, becoming a leader is much like becoming a doctor. You need some academic grounding. That's about 20% of your development. About 50% of your development is actually doing leadership and learning from doing leadership. And then if you have the advantage of having a coach, a mentor, or sponsor, that's kind of the next element. And so I had the opportunity to take on very varied leadership roles in the hospital system, things that I thought, I know nothing about this department, but I was asked to be the leader of it, and swallowed hard and took on those roles and grew in my leadership because I was given the trust and opportunity to do that. And so I think that's key. We did some research through the Canadian Society of Physicians. It used to be called executive, it's now called leaders, to look at really sort of what inspires physician leaders to go into leadership. And not infrequently, it's because you're tapped on the shoulder. Somebody sees something in you that you may not actually see in yourself. They see potential. And I think the key is to, if somebody sees that, if you can grab that opportunity and learn from it, and build on it and ask them to support you in that development. And that's what happened to me. I had somebody who saw something in me, gave me an opportunity, supported my development, and it grew from there.
And now a word from our sponsor. This podcast is sponsored by OMA Insurance, the exclusive provider for the OMSA and the CFMS. Well over half of the medical students in Ontario choose and trust OMA Insurance because they are a wholly owned subsidiary of the Ontario Medical Association. As a not-for-profit and using the group buying power of well over half of Ontario physicians, OMA Insurance provides a wide range of insurance and retirement savings solutions for medical students, residents, and physician members. They have non-commissioned staff who offer objective advice, education, and solutions. OMA Insurance can help you prepare for the unexpected and help get you back on your feet when you need it the most. For instance, did you know that if you take more than 6 weeks off of medical school, you have to restart the year again? And if you're off for 6 months straight, the bank can start to ask for repayment on your line of credit. I personally have disability coverage with OMA Insurance. I got it because school is stressful enough, and I believe it can help keep me and my finances safe during times of uncertainty. Plus, it's affordable and super easy to enroll. Make sure you're protected, because if the last 2 years has taught us anything, it's that life can be very uncertain. OMA Insurance is there to protect you every step of the way. Go to omainsurance.com to learn more about our special offer and exclusive savings for students.
You mentioned before, obviously, teamwork is a very important role, being able to work with others in these leadership roles. Obviously, communication is very important. I'm wondering, are there any other qualities or maybe personality types that fit better within these larger leadership roles?
I often get that question from medical students and residents about what's the most important thing about leadership. And the answer that I always give is learning to lead yourself. There's a whole body of work called emotional intelligence, and I don't know if you're exposed to that now in medical school, but it was never taught when I was in medical school. It's probably the most important thing to develop because exceptional leaders have high emotional intelligence. And sadly, if you look at doctors ranked with other professions, we don't rank high in emotional intelligence as a profession. And so my advice to people is actually learn about that body of work, and you can develop emotional intelligence. It's actually how you manage your own emotions, how you respond to people, how you listen to people, how you respond to people. It's probably the most important skill, and it is the attribute where physician leaders fail, is they haven't learned to regulate themselves or manage their own emotions, or haven't managed how they interact with others. So the most important skill is, I would suggest to any leader, is emotional intelligence. And then you build from there. You develop how to work with different professional groups. You learn how to do strategic work. You learn how to do negotiations. You learn all those other skills. But the foundational skill is actually leading yourself and learning how to engage respectfully and meaningfully with others and work collaboratively with others. Two foundational skills that you need. You need those as clinicians, but you need them less as a one-to-one physician, because there's a power differential between you and your patients. And so it's very different working with colleagues than it is working with patients. There are transferable skills, but there are different skills. And so focus on that in the development.
So I'm wondering, do you think in Canada that medical schools are doing a good job in fostering leadership in medical students? And maybe in what ways could it currently be improved?
I think the challenge with medical schools is the knowledge and skills you need to learn through medical school is so vast these days. And the knowledge just in medical knowledge is so expensive. There's so many demands of the curriculum. It's hard for me to be critical of medical schools because everybody thinks that their area should be in medical school. So I think if medical schools taught the basics of emotional intelligence, which will help people be better clinicians in interacting with patients, but also make them better colleagues. I think if they focused on the foundational skills, that would serve individuals very well. And then they can develop, once you get into residency, you can develop further as you take on roles of senior, junior and senior residents. You can get involved in hospital committees when you're a resident. You can get involved in system changes as a resident. But I think in medical school, you need to learn the foundational pieces of being a good doctor, which is you need the knowledge, you need the interpersonal skills, and you need to know how to work with colleagues, both in medicine and in other professions like nursing and physio and OT. I think if they focus there, that's the foundational leadership skills, and that will help you in your practice as well as contributing as a leader. So how much each medical school is doing at the moment in that, I can't tell you, but that's where I would suggest they focus.
But that's great. It's nice. Medical students can take that initial initiative there and start to learn themselves about more emotional intelligence, learn more about it, explore their own emotional intelligence, and then when they further on in their training, when these opportunities arise, they'll be better equipped to take on these leadership roles. And it sounds like a lot of these leadership roles kind of arise spontaneously, and really it's up to the student or the resident or the physician to decide if that's something that they want to pursue and take on. And if they do have some of these qualities, it may be something that they may want to pursue as a career decision.
I think if people have an interest, they should try and find out what opportunities there are. Sometimes people only see the bigger roles, but there's lots of development roles as a leader where you can actually learn different skills by taking on leading a committee that may be short term. That's a great learning experience, leading a team. And so sometimes just asking, and I've had younger physicians who are relatively new to the system just come and meet with me and say, where are the earlier opportunities that I could look at the sort of earlier development as a leader? So wherever you end up, even at the beginning of residency, find out from your program director, are there opportunities to contribute if you have an interest? And so at least what opportunities there might be. And then when you go into practice, ask the same of the chief of staff or the head of your clinic or the vice president medical of the organization. The other thing I suggest people learn as they sort of go through their medical school and residency is understand a bit about the system in which you're working, because that's something that I have found, I call it system literacy. A lot of doctors don't even understand the system in which they're working, how decisions get made, how it's funded, how it's measured, how quality is measured, who makes decisions. And that's something also that's worthwhile, because a lot of docs, a lot of nurses, a lot of other professions don't really understand the system. They understand their little piece of the system, but having a bigger system lens is also a good way to understand where you can impact the system as a leader.
That's excellent advice. And I've taken so much of your time already. You've been so generous with your time. Before we end off, I was wondering if you could talk a little bit more about your experiences as the co-chair of the Canadian Health Leadership Network, as well as the Premier's Council on Improving Healthcare and Ending Hallway Medicine, and maybe how your roles differed between these two roles.
Certainly happy to. The Canadian Health Leadership Network is a collaborative network of organizations, both national and provincial organizations, that truly believe that good healthcare leadership is a strategic imperative if we're going to positively transform the healthcare system in this country. If you look at the ranking of countries, this year we ranked 10th out of 11th of the Commonwealth ranking of Western healthcare systems. We have a lot of improvement we can make in the Canadian healthcare system, and good leadership is going to be critical, and that leadership needs to come from all professions. People don't earn a right to be at the table as a leader just because you're a doc or just because you're a nurse or just because you're whatever. You need to earn the right because you're a good leader. So it's a group of organizations that come together to really inspire excellent leadership across the country. So I went to the table as a representative of the Canadian Society of Physician Leaders. I was then asked to co-chair the network. It's made up of the Canadian Medical Association, Canadian Nursing Association, Canadian Pharmacy Association, a lot of the Canadian associations, as well as provincial representatives from British Columbia, from Alberta, Saskatchewan, Manitoba. Unfortunately, Ontario doesn't have a rep there, but a lot of the provinces do have somebody there who is really committed to investing in leadership within their healthcare system. So we learned from each other. We did research together to look at what's the best way to develop leaders. What are the critical factors when you think about leadership and inspiring leadership, and what is good leadership? And so we worked together to really look at trying to really change the conversation and the priority around investing in leadership across the country. So that was the goal of that particular committee. We just finished some work on looking at a toolkit for wise practice for leadership development. How do you best develop leaders? It costs money, but where do you best put your money to develop leaders? So that kind of work is work we did together, very collaborative. The Premier's Council in Improving Healthcare and Ending Hallway Medicine was put together and by the Conservative provincial government to really look at a group of independent thought leaders who would actually come together to really try and inform government policy. But it wasn't, we weren't representatives of any particular organization. We were invited as individuals to be thought leaders. There was about 50 of us around the table. And so we did a first report to look at the state of the healthcare system in Ontario. And then we did a series of sessions across the province, what we called co-design sessions, where we had patients and family caregivers and doctors and healthcare providers in the room. There was about 100 people in the room telling us what the priority should be to improve the healthcare system. And it's one of those amazing sessions where you put all those voices together. There is a coherence as to what's important for moving the healthcare system forward. And so we did 10 of those across the province and then coalesced all that input into a second report, really trying to focus on where the priorities need to be to move the healthcare system forward. And then COVID hit. And all energy and all efforts went into managing the COVID response. All the committee members were buried in regional leadership. The supportive team got moved into COVID response. And so I hope that the work that we did helped inspire some of the changes that need to happen. And we were an advisor, we provided advice to the Ministry of Health as they were trying to make decisions about what the system should look like. So we hope that that made a difference, will have an impact as we go forward. But it has not met since COVID struck. We've all been, really focused and buried in that work. And so it was a very interesting place to be because there were thought leaders from across the province and from different sectors in the province, in the healthcare system, which was great.
Yeah, it must have been really interesting to hear from so many different perspectives and different healthcare leaders around Canada there. Yeah, I can imagine you must have done some great work in those committees for sure.
Yeah, I think there's a fellow, Maxwell, who writes about leadership, and he talks about leadership is about influence. And really, it's all about influence. It's not about telling people what to do. It's trying to influence people so that you actually have them engaged in wanting to make the changes that are positive changes for the people that we serve and the people who serve in the system. And so that's what you do as a leader. You actually influence people and hopefully inspire them towards great things. I mean, there are leaders who inspire people to do terrible things. I know that. But as a healthcare leader, your goal is to inspire people to do great things for the people who work in the system, and for the people who are cared for in the system. So really, that's your role as a leader. It's just, you do it in different places. You can do it very locally, or you can do it in a national stage, and some people do it in an international stage, but it is about influence. It's not about telling people, it's not about power, it is about inspiration. And that's really the key thing you do as a leader.
That's excellent. I'm sure you inspired me for sure. I know you're going to inspire many medical students listening to the podcast to explore leadership further. So thank you again for taking the time to be here, Dr. Kernaghan. You were so generous with your time. I'd just like to end it off by asking if you have any final words of advice for the students and residents who may be listening in.
My final advice to medical students is, as you go through your career, never lose sight of why you went into medical school in the first place. If you anchor everything you do in your why, and your why is that you really wanted to make a difference in the lives of people, and you can do that one-on-one, you can do that as a leader, but never lose sight of your why, because your why is what will anchor you. Your why will actually protect you from burnout, because you just don't lose sight of why you're there. Don't get distracted by income, because money has never made a person happy. It can make you got enough, that's enough. But if you try and make decisions just because you want to maintain a lifestyle, that will not make you happy, is what as I've worked with thousands of docs over my career, that will not, making decisions because it makes a bigger income actually will not make you happy. Just anchor yourself in the why and really what you want to do in making a difference. Then you will love your career, and keep your eye open for opportunities to use your strengths and understand your strengths and then leverage those. And then you will love going to work every day. So don't lose sight of two of those things.
That's great. And it's clearly evident from your passion and your joy from what you've been doing in your career. So thank you again so much for taking the time today. And thank you for sharing your experience and expertise in healthcare leadership with us.
Thank you. And thank you for doing this to help your colleagues. Appreciate it very much.
Thank you. So thank you to our listeners for tuning in. If you have any questions or show ideas, please email us at businessandmedicinepodcast@gmail.com or follow us on Facebook at Business and Medicine Podcast. We'll see you next time.